A key advantage of causal analysis is that it removes spurious associations from the data. Let me illustrate this concept with the analysis of suicides. Many think that homeless patients are more likely to commit suicide. Data show high suicide rates among homeless populations. But does homelessness cause suicide? A closer analysis suggests that it does not, and the association between homelessness and suicide is spurious. We arrive at this conclusion because when homelessness is reduced, suicides do not decrease. Randomized studies have shown that even when people receive enough assistance to no longer be homeless, their actual suicide rates don't go down. A reasonable explanation is that mental illness is the underlying cause of both homelessness and suicide. Then, since they both have the same cause, a correlation between homelessness and suicide will exist in the data. Yet the correlation is not real. Changing homelessness does not change suicide rates. Causal analysis helps us understand if relationships in the data are real. Cause and effect is a result of an action, not just an association. If the association is causal, then manipulating and changing the level of causes should lead to changes in the level of effects. When this does not happen, we say the association is spurious, meaning it exists, but it's not causal. Allow me to introduce you to Judea-Pearl's do operation, which gets to the essence of causal versus non-causal analysis. The do operation says that if you want to know how something is causally related, you have to do something and see if your action alters the effect. If you just look at the data without acting and changing it, you will never know. The do operation stratifies the data so that the effect of other variables on treatment is removed. It then examines the treatment effect. Farrokh calls this stratification as doing something because it's sort of like surgery. It isolates treatment variable from everything else in the network. This week will certainly be action-packed, as we will learn how to stratify data and match the rate of occurrence of covariates. We will also do some stratified covariate balancing, a method that I and colleagues have designed for carrying out the do operation in large data sets.